Hello, my name's Dr. Alan. I'm a GP at Birley Health Centre. I'm wanting to help some of the patients get to know us better. I'm hoping to do like little interviews and discussions with some of our staff, asking a few basic questions, and I'm going to go first. So, first question is that how long have I worked here? So it's probably been about 3 years now that I've been working at Burley. Um, what things do I enjoy working about Burley? So I've been thinking about this, and I think that I really so on the one hand, I'm kind of a doctor seeing patients, and we'll talk a bit about that afterwards. But I'm also helped to one of the partners, so I'm kind of responsible for the service running well, and that's something that I really do enjoy. So it's important to me that our patients get the care that they need, and I'm aware that we're in a nationally it's a stretched service, general practice, and I think sometimes dignity. In terms of how people are treated when they're unwell can sometimes be a real challenge, and that's something that I'm being kind of quite passionate about, is how do we make sure that patients get dignity and good care even when we're stretched, and so I've really enjoyed making different changes that have tried to enable that over the few years I've been here. It's about helping people to get people who most need help, making sure that we get that, that they get that. Um, and one of the things that I've kind of realised, it's kind of well, obvious really, is that to be able to do that you need a really good team, and that's about having really great people and bringing out the best in people in the terms of the staff. And so that's something that I've really taken an interest in and really enjoyed whilst I've been here so far as well. I really enjoy communication, patient communication. So things around the Facebook group and making these videos. You know, I think that in the past, general practice has often been kind of you don't really don't get to speak to the GPs or learn more about the service unless you actually get an appointment. And so I've been thinking I quite enjoy working out how can we kind of open up those channels of communication. So like through Ask My GP, more people can write to us and get help, but also through Facebook, we can kind of, or the website, we can get more information to you, and try to open up those channels of communication, and that's what I've really enjoyed as well. Medically, something I really enjoy is shared decision making, which is a way of practicing medicine that I find really satisfying, which is kind of in the past, it might be more that you come with your problem, and the doctor just says, well, this is what we're going to do, but there's often more than one solution, and it's and I really enjoy kind of explaining what those options are and helping. There'll be pros and cons to different options, and really sharing that with the patient and trying to help you to make the best decision for you. I also quite like um, what we call deprescribing, which is where as people kind of go through life, they can accumulate more medications, and it's always helpful at times to have a bit of a rethink about whether or not all the medications you're on are the right ones for you. Maybe some of the ones that we started a long time ago, maybe we don't need them so much now, and so so that kind of helping people to reduce medications that they're not benefiting from so much. And I look after the care home at Brackenfield, and I do enjoy. Again, is around often around kind of helping people to make the because sometimes priorities change as people get older, and sometimes people aren't able to make decisions for themselves anymore, and we have to involve family. And I really enjoy trying to help kind of with all the different medical options we've got with medications and investigations and admissions. How do we get the care that the patient fits for what the patient's priorities are? And then the last question is around kind of what am I most proud of whilst I've been here. I mean, probably quite a lot of things I've talked about really. I think I've played quite a lead role in the Facebook and getting Ask My GP. I think yeah, I think there was a there was a time a few years ago where there was pressure to enable us to have some online solutions, and there were some free ones that had been commissioned, and I spent quite a long time looking at all the different options about really how do they all how does it fit with how we're running as a practice, and Ask My GP really stood out as a really great communication tool, and I think it's been very well received by most patients and by the practice. I think it's really helped us to manage the workload in a way that in a much better than I think a lot of other practices, and yeah, I think that's been a real success. So that's probably been one of my favourite things, as well as bringing in some new new kind of staff through reception. I've been quite involved with that, and that's been really satisfying as well. Yeah, so that's probably me done. I will, all being well, I will work my way around a few of the other staff members, especially people who you don't get to see so often, who do very important roles that are a bit more hidden. So that's it from me.